Yes, thank you, Chair Delgado. Our policy is that if you are vaccinated, you are not required to wear a mask, but you are welcome to wear one if you would like to. If you're not vaccinated, then you are required to wear a mask. And so this meeting we're doing with the board and staff here and virtually for members of the public. And then next month, for June, we'll have our meeting again open to the public. But we do intend to continue with having the Zoom meeting feature as well, so that we can expand access to people be able to participate either virtually or here directly at the meeting. So just nice to see everybody here, the board and staff as well.
All right, thank you for those comments, appreciate it. It's good to see everybody again. If we can go ahead and take roll call, please.
Chair Delgado.
Here.
Vice Chair Lucy will be absent. Michael Brown.
Here.
Councilman Dare.
Here.
Dr. Denko.
She's on up there.
Yes, she is. Dr. Novak.
Here.
Tom Young.
Here.
Chair, we have a quorum.
Perfect, thank you very much. Mr. Tom Young, if you lead us in the pledge, please.
I'd like to.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Oh, thank you. Public comment, Susie.
We have none, Chair.
No public comment, we'll close public comments. We'll move into item 4, approval of the agenda. Mr. District Health Officer, do we have any changes to our agenda? No changes to the agenda?
No changes.
I'll be looking for a motion.
So moved. Second.
Motion and a second. All those in favor?
Aye.
Opposed? Motion carries unanimously. Thank you. Item 5, recognitions. District Health Officer.
Thank you, Chair Delgado. I'd like to begin with recognizing some of the new hires that we have. Recently, Brittany Lucier has joined Environmental Health Services as a EHS trainee, began on May 10th, along with Alyssa Thomas, also an Environmental Health Services trainee. And we have a new member of Air Quality Management, Megan Rennie, who joined just the beginning of this week, Air Quality Management trainee, and new Public Health Nurse 2, Kaylee Barrett, who joined also this week with Community and Clinical Health Services. Then I would also wanted to recognize Ling Barnes, who is celebrating 20 years of service with the Health District. She's Air Quality Management environmental engineer, joined us May 2nd of 2001. Sure.
Just checking with IT, it looks like we're not getting audio on the Zoom. Is that an issue at all with Ms. Reed, or can we continue? Is that okay? Just looks like it's connecting to audio, and I saw.
We'll see if we can resolve it.
Okay, so continue moving forward. Is that okay? I just want to make sure we're good, or hold for now.
Probably should.
Let's hold and see
Okay.
if we can get a resolution.
Recording in progress.
Looks like we're good now. All right. Maybe we do a test. Can you?
We can hear you now.
All right, perfect. Thank you. Sorry, we just caught that for all those in watching in Zoom world right now. We'll we held, and so we'll go ahead and get back to our agenda. Mr. District Health Officer, thank you.
Yes, thank you, Chair Delgado. For members on the call, I was just recognizing our new hires of Brittany Lucier, Lisa Thomas, Megan Rennie, and Kaylee Barrett. And Ling Barnes for 20 years of service as an environmental engineer in air quality management. She was hired May 2nd of 2001. And we have several transfers I wanted to recognize. Kelsey Zaski has transferred from our COVID response, where she was amazing as an office support specialist, over to Human Resources Department at the county. So at least she stays with the county, but a loss to us. And then Michelle Corral, who was promoted from an account clerk at the treasurer's office, or to an account clerk at the treasurer's office, I'm sorry, from our immunizations office, where she was a office assistant too. So another person benefiting the county, but leaving the health district, unfortunately. And then I wanted to ask Dean Trudy Larson if she could maybe stand, and Lisa, if you wanted to come down with her and make some remarks regarding her incredible career here at the health district and with the university and the community.
Test. Tap the mic.
No, just tap
Push it again.
it. Tap it, Lisa?
Tap it.
There you go.
Okay. Good afternoon, Lisa Lottridge, Division Director for Community and Clinical Health Services. Thank you for letting me say a few words about Dr. Larson today. Dr. Larson has been an exceptional consultant, mentor, and partner for Community and Clinical Health Services for the last 37 years. She was our medical consultant for our child health clinic, where we provided preventive care for uninsured and underinsured children in our community. She was our medical consultant, still is, our medical consultant for immunization program. Dr. Larson has always been a phone call away. We can call her anytime to ask questions and get guidance about working with complex situations, such as vaccinating clients with organ and stem cell transplants. She's also provided support and guidance for our COVID vaccination pod. In addition, she was truly a pioneer for her early work with HIV community in Washoe County, including children. Her caring demeanor, astute assessment, and intervention skills have improved the lives of many Washoe County residents. We are so grateful for her guidance and support over the years. Thank you, Dr. Larson.
Thank you.
And
Yeah, please.
if I could add, it's been my honor and privilege to know and be able to work with Dr. Larson. And boy, she's been working with us for 37 years. I am in my 11th year with the health district. But Trudy has just been fantastic to work with. Had the privilege to work with her on the board of the Nevada Public Health Foundation, to participate with her community advisory committee for the school. And she has been most recently active on the governor's medical advisory team. And she was only a phone call away for me throughout the COVID pandemic and response. So very much appreciated that. She's just done a remarkable job, both for us and for the university, and building the School of Community Health Sciences to become accredited and moving forward as a School of Public Health in the future. So thanks for coming over today. Trudy, congratulations on your retirement. And I do have a small token of appreciation for you from the Health District. It says, Washoe County Health District recognizes Dr. Trudy Larson for 37 years of dedicated service as a medical director, 1984 to 2021.
Wow.
So, incredible amount of time. And I would just also add, I recently received an email from Dean Larson that I forwarded out to the Health District. There's been a scholarship endowment that's been established in her name, and it's an opportunity for us to help to contribute to that and support undergraduate students to the school moving forward, and I'll make sure that gets out to the board as well.
Absolutely. Dr. Larson, would you like to say any words? Please, here he is.
I always have to take a deep breath. Saying goodbye is difficult. It has been my honored privilege to work at the health department all these years with incredibly talented and dedicated people. They take the heat when there's hard decisions to make. And I so appreciate their courage in doing this. They keep our community safe. And like I like to tell our students, when public health is working, nothing happens. We don't have outbreaks. We don't have things happen because of public health. So it's been my privilege to be able to actually participate in the practice of public health while being able to train and encourage the next generation of public health professionals. And we have a lot of them, just so you know. We have 2,400 students in our school now.
Wow.
So we have a bright future in this county, and we hope we can keep them here, train them up. Lisa is one of our alums from our Masters of Public Health program. I'm a little biased, but it's a pleasure to work with her as a colleague after getting to work with her as a student. And it's been my pleasure, it truly has. So thank you for that honor.
Absolutely. Thank you so much. And I don't know if there's board members that'd like to say a few words. Yeah, Councilman.
I just want to say thank you, and knowing all the things you do, I think that retiring is not going to be easy. I did, my brain's going to, what does someone who serves in the capacity you do now upon retirement? So we'll like to see you. I'm sure you'll be giving your time somehow out there, so it'll be great to see you out there. Thank you.
I'm on the board of Northern Nevada Hopes, which I helped found. That was many years ago, and I'm passionate about it. So that will give me great pleasure to stay on that board.
Very good. Now you get to go work for free. It's fantastic.
I could argue about the way university people are paid, but
That's funny.
Congratulations.
Congratulations. And Dr. Larson, if I may too, just I know we haven't had a chance to work as closely as I would have loved to. I know you're a legend among so many in our community, and we shouldered your experiences and just your know-how throughout the pandemic. And I know Kevin's spoken so highly of being able to leverage a lot of those relationships and give calls. And a lot of organizations and individuals have thrived because of your knowledge and your input and just your compassion in our community. And thank you so much for everything you've done in 37 years. That's amazing, amazing. And I know that's not the end of it. So thank you for all that you do. Congratulations.
my pleasure.
Yeah, we do applause. We do applause. Yes, yes. And then I'll take a quick. That's awesome. Oh, did you want to do? Are we going back to that? I don't know.
Oh, I'd love to.
All right. Okay.
She wants one and I want.
You have to know I pushed my way pretty far up the line for vaccines, so I could participate fully. It is
Yeah, that has to just stay open. Thanks.
You ready? 1, 2, 3.
Thank you so much.
Scott, did you want to run down with your award before I announce you, and we can take your picture too?
Sure.
Can you help with that award?
I was gonna turn into like a championship belt, but Kevin wouldn't allow it.
How do you want to move your badge? Okay.
So let me then wrap up the special recognitions by acknowledging Scott and the photo we just took with him, who was the recipient of the Silver Spike Award for COVID-19 Communications Champion from the Public Relations Society of America. So this is in recognition of the exceptional job that Mr. Oxerard has done in working to lead the Regional Information Center and tirelessly working to provide information to our community, responding to countless media inquiries and holding tremendous numbers of press briefings. I think well over 90 briefings, somewhere around 600 media updates or something like that. So 480, we'll get there. But it's, I was able to virtually attend the award ceremony, and there were numerous praises for Mr. Oxhart that were expressed in chat by people that were there. So I'm very grateful for the incredible job he's done. Thanks.
Yeah, great job, Ox. By Ox. Yeah, good job, man. Excellent. And I know, Scott, you had a team with you, everyone that was associated with communications across and continue to be. Thank you so much. Communications is critical for us moving forward, so thank you, Scott. Appreciate that very much.
Chair Delgado.
Yes.
I'm sorry, Lieutenant Colonel Jeff Church was trying to make public comment while we had the audio problem. I don't know if we can reopen that for him.
Yes, thank you, Susie. Due to some of the audio issues when we first kicked off, we'll go ahead and go back to a few of those items to make sure that the public is heard. So looking back at our agenda and talk to legal, we're good with item 1 and item 2, and so we'll go to item 3, public comment. So we'll hear from the public comment now.
Mr. Church, go ahead.
You're on mute, Mr. Church.
Yep, just waiting to be called. Thank you very much. My name is Jeffrey Church. Views are mine. I need to do a disclaimer. Although I am an elected trustee for the Washoe County School District, the views are mine. In the military, they taught us to always have 3 main points in our speaking. My main points are, number 1, homeless enforcement by the health district, number 2, shields, and number 3, clear guidance and preferably no masks. Number 1, homeless. We now have the new homeless center open, which I supported and was present at the opening. It's wonderful. So I urge the health department to stay involved in any sanitary issues in enforcing any lapses in that along the river, in our parks, et cetera. Number 2, shields. I know that shields for face covering are not ideal, but as I visit the schools, I see massive civil disobedience among the students. It's like herding cats, trying to get a 10-year-old to keep their mask up. So I urge you to consider shields as an option in any guidance that you give. Not ideal, but it's better than nothing. And number 3, any clear guidance you can give. I understand we're stuck with the federal guidance and the CDC and the governor's directives, but as it comes down to the health district, I really, really like as much clear guidance as you could possibly give, so there's no miscommunication. And I hope we move entirely towards no masks. If people don't want to wear masks, or if they do want to wear masks, they can wear whatever PTE they want to wear, or they can stay home. But those are my 3 main issues. And in closing, thank you very much, and have a great day.
Thank you. Any further public comments? Okay, we'll close public comments. And there was a unanimous approval for the agenda, so we'll move on to item number 6, proclamation.
Thank you, Chair Delgado. I have a proclamation, and I believe that Julie Hunter is here to accept it. And this is for our Emergency Medical Services Week. So, whereas emergency medical services personnel are called upon to help others through one of the most frightening times in their lives, And whereas emergency medical services are a vital public service with personnel ready to provide life-saving care to the community 24 hours a day, 7 days a week. And whereas access to quality emergency care dramatically improves the survival and recovery rate of those who experience sudden illness or injury. And whereas the emergency medical services system consists of men and women in both the public and private sectors, including emergency physicians, emergency nurses, emergency dispatchers, emergency medical technicians, paramedics, firefighters, educators, administrators, volunteers, and others throughout our healthcare system who work together to ensure that those in need receive the highest level of emergency service. And whereas the EMS commitment to patient care throughout Northern Nevada has been an integral factor in our safety and security, and whereas Washoe County is proud to have organizations such as Reno Fire Department, Sparks Fire Department, Truckee Meadows Fire Protection District, North Lake Tahoe Fire Protection District, Reno Tahoe Airport Authority Fire Department, Pyramid Lake Fire EMS, Gerlach Volunteer Fire Department, Remsa Health and CareFlight operating throughout the region to ensure the highest quality of patient care and community support. And whereas the members of emergency medical services teams, whether career or volunteer, engage in thousands of hours of specialized training and continuing education to enhance their life-saving skills. And whereas it is appropriate to recognize the value and the accomplishments of emergency medical services providers by designating Emergency Medical Services Week, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim the week of May 16th through 23rd, 2021 as Emergency Medical Services Week with the theme of This is EMS, Caring for Our Communities, adopted this 27th day of May, 2021. Oscar Delgado, Chair.
Amazing, thank you. Any comments? Broadly speaking, great, beautiful proclamation. Thank you to all those EMS providers, and continue to be safe out there. Appreciate you guys very, very, very much, all of you, men and women. Thank you. Did you want to, is someone here now to collect the proclamation? Is that what you said? Or?
Yeah, I'm not sure if we've got, do we, oh, we do have it, okay.
Okay, just bring that. Item number 7, consent items. Does anybody want to pull any items from the consent from the board?
Chair, if I could just comment on consent
Yes, please.
items, and I think we need to also vote on and approve the proclamation.
Okay, my apologies. Can I get a motion on the accepting the, approving the proclamation?
Make a motion to approve the proclamation. Second.
Second, all those in favor?
Aye.
All
Aye.
opposed? Motion carries unanimously. Thank you. Generally speaking, Kevin's going to make a few comments related to a few of the consent items, but also just looking from the board if there's anything you would like to pull. Seeing none from Dr. Danko. Kevin, go ahead.
Yes, thank you, Chair Delgado. We do have a number of things on the consent agenda today, so I just wanted to acknowledge that we have a large amount of funding from the federal government coming in for the COVID-19 response. So between a couple of these items, almost $20 million that we're grateful to receive for that response, and over $2.5 million that's a contract with UNR using some of those federal funds for the temporary staffing that they're providing us. And then I also wanted to mention there are a number of settlement agreements for air quality management. And the reason for this, these settlements span a period from August of 2020 through March of 2021. So the air quality program is basically catching up on some of their enforcement work with the lags that were occurring during COVID response period. So that's why you're seeing a number of those, and we may have some more coming next week. But I also wanted to comment on specifically on the item E, which is a supplemental environmental project with Rhyolite Aggregate Company. And this is the first supplemental environmental project that we've brought to the board for approval. And this is an innovative approach where rather than imposing fines and penalties because of the dust violations that have occurred. We're working with this company for them to make investments in improving their operations to be able to avoid these kinds of dust issues occurring in the future. So this is a project for them to work with a geotech engineering company to modify their pit design in order to mitigate against the issues that are causing the dust problems. So thank you very much.
Yes, Councilman.
I want to give Francisco and his team props for this kind of approach. And I say that one of the things I think is crucial for any of what we do, I like that we go in and obviously we have a role to play, but I like when we take people alongside and help them understand behind the scenes what's happening, and I think it's a great approach, and I look forward to seeing the outcome of that. So when it comes to that, I do have another, when we're done with that, I have one question on the minutes. I have to say something, but.
Sure. Did,
It's part of the consent.
Yeah, it's part of the consent, yeah. Any further comments related to the consent items? No? Go ahead and talk about the minutes and we'll
I
get everything.
just on point 15, it reads in a sense, and I'm not trying to bring up old things because we're way past it, but for sense of being correct, it sounds like I was echoing what Mr. Dick was saying, and that's not actually true. I was not echoing. I was actually saying I want us to move forward and not hold things back. And during that conversation, so as far as Fastidious Sparks and myself, we wanted to move forward as rapidly and not put other things in place. And at that time, there was other things in place. So I just want to make sure for the record, it's just correct, because it does not say that. I did say, and I have no problem agreeing with this, I appreciated our health officer, Kevin Dick, calling all of us, letting us know that is true. That, please keep that in there. But the part of me echoing what he said, that's not actually true, if you remember. So, thank you.
Sure. So we'll make, with respect to the minutes, we'll make corrections to the minutes as amended, and no further comments. Can I get a motion for the consent items?
I move to approve the consent items.
Yes,
Second.
motion and second. All those in favor?
Aye.
Aye.
All opposed? Motion moves unanimously. Thank you. Moving on to item number 8, Regional Emergency Medical Services Authority, District Health Officer. Oh, well, it looks like we'll get that from Mr. Dean Dow. I believe I saw him on Zoom there.
Good afternoon, Mr. Chairman and members of the board. Dean Dow, President and CEO of Remsa Health and CareFlight for the record. You all have received a copy of our April compliance report for your review, and I'm available for any questions.
Any questions for Mr. Dow from the board? See no many public comment.
No comment, Chair.
No public comment. Can I get a motion, please?
I'll make a motion to accept the report as presented.
Second.
Motion is second. All in favor?
Aye.
All opposed? Motion carries. Item 8B, Ms. Jobson.
Good afternoon, Mr. Chairman, members of the board. Alexia Jobson, Public Affairs Manager for Remsa Health for the record. You have for your review the Public Relations Report for April. And I do have some more recent news to share. As you heard, last week was EMS week and there was a lot to celebrate at Remsa. We celebrated the 35th and 40th anniversaries of CareFlight, of Remsa and CareFlight respectively. We also recognize the hard work and important contributions of all of our staff and healthcare providers, particularly over the last 14 months. EMS providers are professionals who provide compassionate, essential care, and never more so than during the battle with COVID-19. This was an extraordinary year, and they deserved a special acknowledgement for being at the tip of the healthcare spear. And the final component of our EMS week celebration last week is that, as you have all probably heard, we announced a refreshed look and name for our organization that better reflects the important work and innovative contributions Remsa and CareFlight have been making for the past 3.5 and 4 decades, respectively. We are now Remsa Health. And if you'll allow me, I'd offer just a short insight and a couple of explanations about this change and update. There have been many changes in healthcare in our decades of operation, including the way we respond to calls for medical care and in providing solutions to care outside of the hospital setting. We are not just a one-dimensional medical transport company. The care we provide is dynamic and extensive. And as we honor our legacy and embrace our future as a pioneer in out-of-hospital healthcare, there are 4 pillars that guide our work and differentiate Remsa Health from physician offices, hospitals, or public safety and first response agencies. They are the focal points of what people expect from Remsa Health. They are care, innovation, community, and urgency. The name Remsa Health fully expresses all of our contributions, which include not only world-class emergency medical services, but also our evolving innovative programs that address community and population health, strategic partnerships, leadership, and health education and prevention. If you'd like to learn more about our exciting announcement, I'd encourage you to visit remsahealth.com, and I am also available to answer any questions you may have about our public relations report.
Any questions for Ms. Jobson? Councilman.
I just want to thank you. They did a fantastic job, and I know John was there, and we got to go and just celebrate with them this, and it was great having everyone together. And I just tell you, it's neat because I think it really continues to push and encourage the morale to be strong, and you could tell that people there have worked very hard this year, and I do believe those things are important. So I just say for us as a board, the more that we can continue to cheer on, and these are individuals with families that have given a lot, and so I would just encourage you to remember that and to continue to stand with them where we can. So thank you. It was a good time, and I think you deserve those awards. Thank you.
Thanks, Councilman.
Great comments, great comments. Any further comments? Seeing none, thank you so much, appreciate it. See you next month. We'll close item number 8B. We'll move on to item 9, discussion. Ms. Julie Hunter.
Is it on?
Yep.
Okay. Good afternoon, Mr. Chairman and members of the board. For the record, Julie Hunter, EMS coordinator, and it's great to be back in the chambers again. I had to just say that. So this item, the oversight, the franchise compliant checklist was developed by the EMS Oversight Program in 2015 and approved by the board in 2016. This checklist is developed to ensure that all of the documentation required by the franchise agreement is properly submitted by both Remsa and the EMS Oversight Program. So the Oversight Program recently reviewed and made revisions to this checklist in April of 2021. We also then met with Remsa to review these suggested revisions and additions to the checklist to ensure that both parties were in agreement. The revisions were made to more closely align with the franchise agreement and to ensure that documentation provided to the EMS Oversight Program is accurate and valid. Many of the changes included just clarification of documentation needed, requesting formal documentation, and the removal of redundant documentation, which there was quite a bit of redundancy. These changes to the franchise checklist are clarified in the red line version that you received in your board packet. And if there's any questions, I'd be happy to take those now.
Any questions, Councilman?
I didn't see the red line of that. I saw the red line of the packet, and I don't know if I'm just missing it.
It was missing this morning.
It was sent to all board
You
members.
got the red line. How did you get so special? I didn't receive it. Thank you. Thank you.
Yeah.
Questions for Ms. Hunter? Seeing none, can I have a motion, please?
So moved.
A motion
Second.
and a second. Seeing other, can I get a motion? Sorry, it's over here buzzing. All those in favor?
Aye.
Aye.
All opposed? Motion carries unanimously. Thank you, Ms. Hunter. Moving on to item number 10, presentation discussion, possible approval. Ms. Hunter, you're back. Good to see you.
Okay, good afternoon again, members of the board. For the record, Julie Hunter, EMS coordinator. The Washoe County EMS Strategic Plan is a requirement of the interlocal agreement for the Emergency Medical Services Oversight. The mission of the strategic plan is to coordinate the delivery of efficient and effective emergency medical services to the citizens, businesses, and visitors of Washoe County through collaboration with EMS providers. The 2019 and 2023 strategic plan was approved by the EMS Advisory Board on May 2nd of 2019. On May 6th of 2021, these revisions were added and presented to the EMS Advisory Board and were also approved by the EMS Advisory Board. The EMS Oversight Program did start working with the EMS partners to review recommendations in the Tri-Data report and the CPSM report to come up with recommendations specifically related to EMS to determine and identify what of these priorities still needed to be incorporated into the goals of the strategic plan. So we revised the strategic plan to closely align with those recommendations in the Tri-Data and the CPSM report and added them to the strategic plan. The main priorities included in the plan were training, legal protection, priority response, automatic response agreements, and standardized performance measures across all agencies. These priorities were incorporated into goal number 1, 2, 4, with the addition of goal number 7, which was to include legal protection for all agencies. And again, an outline of the additions of the objectives and strategies are outlined in the staff report, and there is also a red line and a clean version. If you have any questions on the revisions or additions, I'm happy to take those now.
Any questions from the board? Okay, we'll jump to Mr. Brown and then Councilman Dare.
I just want to say, thank you to Julie and different members that worked. Program managers have changed during this process, but they kept the process going, and they did it in a very efficient manner. There's no doubt about it. So the staff, Kevin, they did a great job from the prior staff and to our current staff. I know a lot of time has been spent by a lot of folks, a lot of hours. So thank you very much, Julie, for getting that done.
Thank you, and I have to thank all the EMS partners for their patience with me learning and also bringing back up history. So thank you.
Thank you. Okay, Councilman.
So going through, I appreciate all the technology conversations and different looks. The only question I have is goal number 3 was untouched. And it seems in my conversations over these last years, it's one of the biggest conversations that are not happening how I would like to see.
Okay.
And so I don't, I did bring this up to your chair as well already, so he's not gonna be surprised by it.
Okay.
But so I don't understand why, I don't want to see in 2 years us exactly where we're at now, which would mean I think a new goal should be in there
Okay.
of some sort. Because I think we need to see that work better.
Okay. We will bring that up at the next
Thank you.
meeting. Thank you.
Thank you for those comments, Councilman. I felt the same way. Thank you for that. Any further comments from the board? Seeing none, can I have a motion, please?
I'll make a motion to approve as presented. Thank you, Julie.
Motion and a second. All those in favor?
Aye.
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 All opposed? Motion carries unanimously. Thank you. Item number 11, Public Health Officer. We have Mr. English presented, but did you have any comments on this one?
No, I'm going to let Mr. English go ahead and proceed with this one. Thanks.
Good afternoon, Chair Delgado and members of the board. James English, Environmental Health Specialist Supervisor for the record. I'm before you today with a regulation amendment as a result of SB4, which is the 32nd session of the Nevada Legislature in 2020. Section 15 requires us to substantially adopt identical regulations or amend or appeal substantially identical regulations to be in conformance with SB4. So with that, the Nevada Division of Health and Human Services on April 30th, 2021 did make amendments to NAC 447, which as it relates to SARS-CoV-2 with public accommodation facilities. As a result of that, I'm before you today with the regulation amendment to our permanent regs of the Washoe County District Board of Health governing public accommodations. With that, we in September of 2020 adopted an emergency regulation, as you all recall, as a requirement from the 32nd session. Since that time, we went through the formal regulation process where we actually had the business impact statements, we had all the hearings, and we created a permanent public accommodation facilities regulation. That went into effect in December of 2020, approved by this board. It went to the State Board of Health in 2021. As part of that, we actually included the emergency regulations as Appendix A. So what you have before you, I tried to make it as simple as possible with some input from the health officer that we put the actual regulation changes in your staff report. You'll see we are adopting a definition of the extent reasonably possible in the actual appendix of the NAC 447E and readopting that by reference. What we did was inside the permanent regulation, we have put two sections in there at the end referencing Appendix A. The first one documents the date that we are before you today looking to have this regulation approved. And then the second one is a section so that as this regulation, these emergency regulations change or are altered, we do not need to be before the Board of Health every single time. When we do a substantial update to these regulations or a permanent update at that time, we'll adopt the most current referenced NAC 447E if it still exists. This regulation change has no financial impact on our businesses. Furthermore, I did have a public Zoom workshop. It was very well attended, 43 individuals, all 17 properties were in attendance. They were also emailed by me directly and by our staff what the regulation changes were. I did talk with some of them. They are supportive of this. This reg change is specific to social distancing between employees and guests and employees, and will bring us into conformance with the Gaming Control Board, this regulation, and actually our local control plan. So with that, we're asking that this regulation be adopted today by the vote of the board. I do not need to go back to the State Board of Health, even though this is a permanent regulation. They are okay with this, and it will become effective at 12:01 a.m. on June 1st in conformance with our local control plan.
Great summary. Any questions? Councilman Dare.
Are we saying, I just want to make sure what I'm voting on here. Are we saying that if there's changes, you won't bring them to us anymore?
We will bring those forward, and we can bring those forward in a staff report if you'd like, but we're required by state law to go ahead and make those changes. We're trying to ease the process so that we're not here every time there are changes. Right now, the legislature is looking at this legislation and looking to make additional changes, and it could be quite possible that we could be before you in June changing this permanent regulation again.
So for me, I don't know that I care the process, and I get what we're doing here, so you guys can move forward behind the scenes and getting things done, so I guess I'm okay. But for me, because this affects every one of our cities, all of what we do in our county, and even though I know that sometimes they don't really want our opinion so much, they're trying to just say this is what you should do, I think we're in place to give our opinion, and we're here to help guide and help process some of these things. So I would like any changes to continue to come to us, and I'm not interested in them not coming to me. So however we want to figure that out, I just kind of give that back to you, that that's really important to me, and I think to the public that that's part of our role as an elected official, but also as a health board, in my opinion.
If I could just add,
Yes.
I understand the concern that Councilman Dare has. I think what we were trying to do was just to try to streamline the process, because under the statute, SB 4, it says that the board must adopt the same regulations or something substantively similar to it within a certain time frame of when any amendments are made to the state NAC. So since that wording was in place in the statute, we just wanted to try to point back to the NAC, so when they made changes to the NAC, then that became effective here in Washoe County.
It sounds like, Councilman, you'd like to be informed as changes can move forward. Did you want to, are you stating that you'd like to vote on those items still as they come forward, or allow the process
Well,
to
and
ease them to go?
here's a way, I mean, I know everyone looks at these things a little differently, I guess. I understand that the state, and they have certain regulatory power, I get that. However, everything that comes, and we still get to be the filter to those things. And even when it comes down in some mandate portion, I think we should be involved. Now, some of that, it could be a conversation that seems to fall on deaf ears or whatever, but I still think the conversation should be had. So I actually think I'd rather vote on it if I just, in my opinion. Now, I don't know how much work that puts on our staff. I mean, is this a labor intensive for our staff that we're saving not of time? Because to me, again, I understand, but we are the ones the closest to the people of what's going to be affected. Let's say in July, the pandemic continues. Let's say something sadly moves the wrong direction. I want to be able to have that conversation before it just goes. And I think that's important.
So from a staff perspective, it's not that difficult for us to change these regulations. We're required in the Senate bill to actually do it and to do it within 15 days of the state passing it. So as I would see it, and I'd ask our deputy DA to weigh in, it would really be the need that this board would have to come together as we did in September and have a special meeting. Historically, prior to us having a permanent public accommodation regulations, we just utilized by reference NAC 447.
And if I could add to that, I'll be reporting, giving you the legislative update, but there are other proposed changes to SB4 that are in a bill being considered now that would require the District Board of Health to adopt any changes that are made within 5 days after NAC is changed.
I'm gonna say one more thing and then I'll be quiet. I know, hopefully somebody else says something, because hopefully I'm not the only one here.
Dr. Novak's up
So,
next.
but, so for me, and this may sound crazy, people can make decisions on a state. We still are the filter that stand up and make decisions on a local level. And we have a reason we're elected, and there's a reason we're here. And I'm not mad at anybody here. I'm not saying that to you like you don't know that. But I'm saying it on the record why I believe, I appreciate when somebody says you're required or mandated. But I'm saying I appreciate that, but you don't get to remove my role as an elected official just because you're an elected official where you're at. I don't believe that, and I'll talk to anybody who wants to talk about that, but I don't believe that is correct. So I'm done. Thank you.
Dr. Novak?
Can we, because of the possibility of changing it down to a 5-day change where we have to, can we just possibly do it by sending out something directly to the board? If we need to send comments back, to have some input, like what, Councilman Dare, we can send back at least some input to the health district through Mr. Dick or something like that.
Is that an open meetings issue?
I can read that sign language.
I haven't finished the sentence up there.
Well, microphone doesn't work, but if you can hear me, right, that would be considered deliberation under the open meeting law, so that would have to be done in an open meeting. As written, if you approve today, what the regulation change that Mr. English is referring to did is it essentially said, in compliance with SB4, this board is adopting, or essentially adopting is the language that NAC provisions and any subsequent amendments. So if the state amends the NAC by this action, the NAC attachment to the regulations that you already adopted in an open meeting would just simply be the NAC of reference. So that's essentially what is happening, and so we wouldn't be in a position of trying to hold a special meeting within a 5-day time frame in order to basically adopt what the state and the legislature has said has to be the regulatory framework. So that language is contained in what you're adopting today, just for the purposes of the SB4 state NAC, not for the public accommodation regulations themselves. Those are Washoe County Health District regulations, and of course, Mr. English or anybody on his team would bring those through the normal process. If that helps clarify a little bit of what the protocol would be.
Further questions from the board? Yes.
Yeah, Oscar, I agree with Councilman Dare's assessment and some of the issues with SB4. I think this particular legislation was written quite hastily before all the facts were in to get something done, to say the least, and things too. I also think that things are winding down on the legislation instead of like ramping up. I would hope, but if indeed it's difficult for us or not going to be feasible for us to actually have a vote, I would at least like to see, maybe at least in our board meetings, a summary of what has been done on a regular basis, not in the consent item, but in the actual meeting, so we can actually comment and possibly, move forward with whatever has been done, things too. But I think this has been a difficult piece of legislation for this Health Division to actually work with, and I'm kind of like hoping we see it kind of vanishing pretty soon. But anyway, so I would at least like some updates on a monthly basis so that we can be appraised of what's going on.
Further comment? I like where you're going there, Mr. Young. Any public comment on this, Susan? Seeing no public comment, Mr. Young, I'll look for you for a motion, sir.
Sorry to interrupt. I just want to make sure we're also clear that we're going to repeal the emergency regulation that was adopted in September. It's no longer necessary.
Dr. Noack, was it?
No, what Tom's last comment was, that's what I was trying to get across.
Yeah.
Just send out a notice, these are the changes, not to start any comments or negotiations.
Right.
But I think he phrased it better than I did.
Right.
We just kind of like some notification, that's all.
1000%. Absolutely agree with that. Looking to the board for a motion. There's some language there. Do you need that language read for what it's stated there?
Yes.
Mr. English, yes? Okay, so somebody can read the language as presented by staff there on a possible motion. Councilman Dare.
I move that we accept the staff's recommendation on this one with the issue that we will have some informational sessions ongoing.
If you could read that language right there too, Mr. Young, that's
What's that?
presented. There's a language that Mr. English would like for you to read
Okay.
on the record. There you go.
All right.
Thank you.
Okay. I move to adopt the amendments of the regulations of the Washoe County District Board of Health governing public accommodation facilities. Regulations as amended and adopted by the Nevada Department of Health and Human Services on April 30th, 2021, as required by Senate Bill 4 of the 32nd Special Session 2020, with an effective date of June 1st, 2021, and repeal the regulations of the Washoe County District Board of Health governing 447E regulations related to the SARS-CoV-2 or SARS-CoV-2 and public accommodation facilities as approved at the special meeting of the District Board of Health on September 10th, 2020.
Great motion.
Second, well,
Motion and a second. Any further discussion?
One discussion.
Discussion, Councilman.
I just want to, and I know it's not part of this is us talking. I think it's important that it's agendaized and not just in a staff. I mean, I want to be able to have a conversation about it. I just want to make sure that was, okay, thank you.
Got direction, got our motions. All in favor, say aye.
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 All opposed, motion carries. Thank you, Mr. English.
Thank you for reading the motion exactly for the record. And I fully am anticipating then being back in front of you at the June Board of Health meeting, as I think my staff will, our director and the health officer, with some more logical changes to this legislation. Thank you.
We'll wait to hear Mr. Young's voice again next month.
Certainly.
District Health Officer, item number 12.
Yes, thank you, Chair Delgado. Joelle Gutman Dodson has given birth to a healthy baby girl, so she is on maternity leave. And so I will attempt to give you a legislative update. As everybody knows, we're in the final days of the session. Some different things that are in play. So one of them is SB 386. This is the right to rehire bill that was driven by casino workers that wanted to be reemployed, get their job back versus somebody else being hired. And there have been some amendments that have been made to that bill from discussions between the Resort Association and the Culinary Union in regards to SB 4. So there are amendments to the bill that remove the social distancing requirements completely from SB4, which would be much cleaner than sort of the wriggle room language of that amendment. It also reduces the cleaning and laundry requirements, some of which were quite onerous to the properties, particularly in regards to bedding and decorative bedding features. It also changes the leave pay requirements for the employees that are required to be quarantined for COVID-19 exposure, so that those provisions are in place for people that are vaccinated, that require quarantine or isolation, or for people who are not able to be vaccinated because of medical reasons. But it removes those provisions for people that just choose not to be vaccinated. There is one of the areas of amendment that we don't support, and that is they struck the part of the regulations in regards to the cleaning that required that the properties use an EPA-approved cleaner that's effective against COVID-19 or the SARS-CoV-2 virus. And so we're hopeful that they can put that back in because we're still required to conduct inspections of these properties. And for us to, one of the ways they reduced the cleaning requirements also was to reduce from multiple times a day to daily for a number of the areas. But if we're inspecting for how they're conducting that cleaning and they're not required to use an EPA approved product, then we're basically conducting performance art out there doing an inspection, because there's nothing really to inspect about anything effective for cleaning. So we'll see where that one ends up. For AB 349, which is the removing the loophole to the classic vehicle exemption plates, exemption from the smog check, that one had a fee increase for the smog certificates in it, which therefore required that 2/3 majority vote for it. And that provision is going to be removed, so that no longer requires that 2/3 majority vote. That fee increase was also supposed to support a repair and replace type program to help with repairing some of these older vehicles. And so some of that program provision has been removed. The bill does provide a provision for the county commissioners in counties with a population of over 100,000 to be able to establish a fee increase for that and to support that kind of a program. So that would be an option if the county commissioners were to move forward with it. So we think that at least this is moving forward with the primary objective of reducing the number of those junker vehicles that aren't really classics that get those plates. SB 424 is out of the Senate into the Assembly, and this one creates the Public Health Resource Office. And so this is an effort to really elevate the work that's done around what are our public health needs in Nevada and how do we adequately resource those needs. It's been amended to move it from Department of Health and Human Services to the governor's office, which is a good thing. I thought just starting with the office was a good thing. I think what we've seen historically is with the breadth of what the Department of Health and Human Services responsibilities are, and the amount of both their budget and those responsibilities that are dedicated to healthcare and behavioral health, that public health ends up getting sort of short shrift sometimes as far as priorities for the budgets that's presented to the governor and those things. So I think this could be very helpful for public health and it getting the resources that it needs through the state in the future.
Quick question on that. Is that going to be also almost some new regulatory things over all the health boards in the state? Or, I know you said the positive part, that we might get resources, but there's also, whenever you put someone in place, that could potentially be an umbrella over what we do.
Yeah, it says that they're to work with us. I don't think that they're going to be directing us directly. I think that the concern would be if they are on a separate agenda and trying to find resources for programs that we don't view as priorities. And so I think it's a matter, it's really a matter of whether we're going to end up with funds in the right places. And so I'm still taking a positive view on it, that we'll work with them and hopefully have that influence. But I'd rather get funds in the wrong places than no funds at all. So, and then to move on to SB 318. That one was a bill that was basically, it had a lot of record-keeping requirements in it on keeping track of all of the different contacts that the health district has from the people in the community and what their language preferences were. Could have been quite onerous, but the language has been toned down to the extent reasonable. So we're more comfortable with that bill right now. And then SB 263 was the bill from the last session, last regular session, that was the vaping bill. And from the revenue from that bill over this past biennium, we received funding for our vaping prevention program. That was not continued in this year's budget, but it appears that this is on the list for add-in funding, so that as the session wraps up, we are optimistic, positive view on this one, Councilman Dara, that money, I think, may well be shoved back in there. So keep your fingers crossed for that one. So that's my summary. I'm sure Ms. Gutman-Dodson could have done a better job, but filling in.
Thank you for that update. Any further questions related to the legislature for District Health Officer? Seeing none, since for possible action, do we need to take action on? Nope, we won't take action on item 12. We'll move on to item number 13, staff reports. 13A, Mr. Vega, you with us? Yes, you are.
I don't have it. Oh, sorry. Chair Delgado, members of the board, thank you. For the record, Francisco Vega, Director of the Washoe County Air Quality Management Division. I don't have anything to add to my report, but I did want to make myself available to answer any questions regarding the supplemental environmental project. As Mr. Health Officer described, this is kind of the first of its kind. And while it's the first of its kind here, it was a tool that I used quite frequently when I was with the Nevada Division of Environmental Protection. So it's something that we used and quite successfully as well. So I'd like to answer any questions you guys might have.
Great. Councilman.
I just have one question. Are we going to be able to hear I'd like to hear how it went.
Oh, yeah.
When it's all done.
Oh, yeah.
That's what I'm saying. I'd love to hear how it went and how we could potentially use this kind of thing in the future, so.
For sure. One of the requirements of the supplemental environmental project that they put together a final report describing what work was done and how they achieved compliance. So we can absolutely share that.
Mm-hmm. Good job, man. I like it. Yes, Mr. Young.
I'm sorry, I just have one question too. With there was we heard the reason there was such a thick part of the consent agenda was because we, packaged all these things up, I guess through March or something like that too. But throughout moving forward and things too, what is the number one times when you actually issue a citation, for instance? Is that just dust and construction sites, or what is the primary issues that you guys are facing all the time?
Yeah, thank you for the question. I'd have to go back and take a look at the actual data, but I believe one of our top violations is actually dust or fugitive dust violations. But again, I'd have to take a look at the data, but I'm pretty confident that's the case.
Okay, I was just curious. I mean, and that particular one, when you're out there talking to some of these offenders and things too, what kind of resistance are you receiving or on that? Or, you know, I do like the issue, the proactive part of it that was coming with the Rhyolite group and things too. But is there something, you know, we can do to educate or help these guys out so we don't even have as many dust abatement issues?
Absolutely. I would say it varies from case to case. Some are extremely accepting that the fact that, you know, there is an issue that needs to be resolved, for example, like Rhyolite. Others are in agreement that there is a problem there. In regards to education, yeah, absolutely. Open any kind of ideas as far as, you know, how to get the information out there on what they can do better. For sure.
Okay.
Yeah. Mr. Vega, I assume that you a lot of that education usually goes through some of our groups, so the AGC, the builders, and so forth, and that they're all primed in terms of what opportunities there are, and if there's players that aren't necessarily working as well, that's an outlet for educational opportunities. If you see constant people that aren't necessarily following regs as best as we would like to. I mean, is that what you're doing now too, working with those groups?
Yeah, I mean, we were meeting quite routinely with the AGC and that group.
Yeah.
That was on pause because of COVID.
Sure.
I will say that recently we have reached out to that group and trying to get those meetings going again.
Good.
And this is absolutely one of the topics that will be discussed.
Great.
Yeah.
Further comments from the board? Seeing none. Thank you, sir. I appreciate it. Moving on to item 13B. We have Ms. Loretz, is that? Yep. Loretz, yeah.
Lisa Lottridge, Division Director for Community and Clinical Health Services. I just have a couple updates to my report. Just to let you know, Dr. Vanessa Slots will be taking over as our Medical Director for the immunization program as of July 1st. And our family planning program yesterday, for the first time in 15 months, was able to get back out to the sheriff's office and do conduct services. So we're very excited about that. And then lastly, the American Rescue Plan funding is allowing WIC to provide an additional $35 per month per child and adult in fruits and vegetables.
That's great.
This is temporary, but hopefully it will go through September, and we're really excited about that for our clients. And I'm happy to answer any other questions you might have about my report.
That's good news. Councilman Dare?
Have you seen an increase just with COVID and people potentially losing their jobs, homes, and things where people coming looking for services since this last, or not?
You know, not in the clinic. We're getting back. Our numbers were down quite a bit throughout, you know, the last 15 months. We're finally getting back up there, but you would think that, you know, people would be reaching, you know, coming out for our services, but they really, they weren't. And I don't know if it was because people just weren't going out. And that's why we're seeing a lot of kids behind on immunizations. A lot of people weren't getting the services that they needed. But unfortunately, not a huge increase. But with WIC, we have been able to keep all of our services. We kept them going throughout the entire time. So, but we are starting to see a little upswing.
That's good. Further comments? Seeing none, we'll accept your report. Thank you.
Thank you.
Appreciate it. Good news. Item C, Ms. Dixon.
Good afternoon. For the record, Erin Dixon, Environmental Health Services. Just two additional updates to the board item. Staff are very busy completing all of our pool openings. Not only is it seasonal, but as you're aware, COVID had shut down all of what we call our spas, general public calls hot tubs, and so they have recently reopened. As of this morning, approximately 50% of all pool and hot tub inspections have been completed, and that's approximately 300 inspections. So I know we have another 20-some scheduled for tomorrow as well. And while we were the Crumbine Award winners, and you're going to hear me say that a lot because we're really proud of that,
As you
we
should.
actually do have a national consultant working with us this week. He started here on Monday. And what he is here to do is to ensure that our staff is FDA standardized. And so that is for us to be in continued conformance with Standard 2 of the FDA Retail Program Standards. We need to be, quote, standardized. So this is a long process for our staff. We will have 5 staff going through the standardization process between now and the first week in July. It takes about 4 days per staff member. And then what will happen is that team of 5 will then be able to, quote, standardize the rest of our team. So always trying to make sure we're on the cutting edge and doing what we need to do for our community. And so that's it, and I'm available to answer any questions you may have.
Thank you. Any questions, Ms. Dixon? None? I will tell you that I had an opportunity to inspect Trainer Pool with Mr. Lupin. Is it Lupin?
Lupin, yes.
Lupin, yeah. It was a great opportunity. Board, as I've shared with all of you before, every other Monday I've taken it upon myself to shadow a different department in the health district to see the great work that they do. And it was a great opportunity just to see the work and them explaining how we do the great work. And then again, the customer service is amazing and how they're able to work with a lot of our, whether it's a business or it's the city or anyone else, to make sure that our operations are safe and well maintained for our community. So thank you.
Great.
Thank you to him as well.
Thank you very much. And if any of the other board members would like to shadow, please let me know. That opportunity is available.
Yeah, thank you.
Thank you.
We'll close item C, move on to item D. Dr. Dow.
Sorry. I left it nice and wet for you.
Good afternoon, everyone. Mr. Chairman and members of the board, this is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. So you have our division report with you. There are no further changes or updates to the report. I do want to quickly highlight 2 things in our activities. So on May 4th, our healthcare preparedness team held a burn care and mass casualty course. This was a day of interactive training with specialists from the University of Utah Healthcare Center and Department of Health. The course included an overview of adult and pediatric burn patient management from the field post-injury, in addition to burn disaster crisis standards of care. The day concluded with an overview of the coalition, response plans from the local to federal level, and a burn mass casualty tabletop exercise. The burn care course was very important to our region because we don't have a burn care center here in Washoe County. The closest burn care center to us is in Sacramento. So hospitals needed to learn about the resources that's available to them to care for a patient up to 96 hours in the event that a burn bed was not available immediately to them. So over 100 people from over 40 different organizations attended from across the state, including fire, hospitals, Care Flight, School District, and the Clark County Coalition. The other thing I really wanted to bring up is in our epidemiology program. Since the latter part of April, we started this year's distribution of our Epi Newsletters. There are newsletters that's coming out with short 2-pagers that provide an overview of a communicable disease, transmission patterns, symptoms, and screening updates. These Epi News serve to bring awareness and education to specific disease based on recent upticks and seasonal changes. So May is Hepatitis Awareness Month. Thus, the coverage this month are Hepatitis A, B, and C. We are also hitting tick season with the warmer weather, so some of the other upcoming issues will cover tick-borne diseases. We're sending the Epi News out on a weekly basis, and these are distributed to our subscribers from hospitals, physicians, healthcare workers, as well as being archived in the Washoe County Health District website for public access. Thank you. That's all my update. I'm happy to answer any questions you may have.
Thank you. Any questions for Dr. Dow? Seeing none, thank you for your report. Appreciate it. Thank you, Dr. Dow. Item E, District Health Officer.
Thank you, Chair Delgado. I just wanted to provide some updated statistics in regards to our COVID-19 response. Things are continuing to move in the right direction, and our number of cases and our positivity rates have continued to decline. So our 30-day, our new cases per 100,000 population over a 30-day period now stands at 155, down from 194 just on May 17th when I put the report together. And our test positivity rate has declined to 4.1% from 4.8%. Our demand for testing is still continuing to decline as well, down to 150 tests per 100,000 population per day. And I want to say I'm very proud of the job that the Health District and all of our partners with our Livestock Event Center pod have done, as well as our partners in the community, including our Community Health Alliance and other providers, and providing the vaccinations. But also I'm proud of our community for how they're continuing to step up and be vaccinated. And so we're leading the state in the number of people that are getting vaccinated here in Washoe County. And for as an update on the vaccines administered, doses per 100,000 population, Washoe County is now at 85,810. And you can compare that to the Quad counties, which are at 74,370 per 100,000. So we're basically 11% ahead of the Quad counties. Clark County is at 68,769 per 100,000. So we're about 17% ahead of Clark County on doses administered. And the remainder of the state is at 54,670 doses per 100,000 population. So we're over 30% ahead of those other areas of the state. And so the currently we have 55.74% of the county population 12 and older that have initiated vaccinations, and we're at 48.28% of the 12 and older population that's completed vaccinations. We're now over 50% of the 16 and older population that's completed vaccinations. So I'm quite pleased with both what we're seeing with the reduced number of cases and positivity rate, and the increasing number of people being vaccinated. And I think we're really in a good position as we move forward with the full reopening coming up in a few days here on June 1st. And that's due to a lot of hard work by a number of people, but also by our community being responsive and getting vaccinated. And then just one other quick update on the county budget process. The Board of County Commissioners on May 18th took action to adopt the budget, and that included our health district budget of $25.6 million. And then on top of that, we'll have all of the grant dollars that were approved by the board today that'll be going to the county commissioners and being added to our budget moving forward as well. So I'd be happy to take any questions.
Great news. Good news all the way around. Questions from the board? See none. Thank you. Please give all my gratitude and thank you to all the team. Kevin, I really, really appreciate it. We're not there yet, but we made some tremendous amount of strides. Thank you. Thank you. Thank you. I will close item E, moving on to item 14, board comments. Any comments from the board? See no comments from the board? Oh, yes. Oh, sorry.
I have one too.
Dr. Novak.
I think about, I just, as I have for the last couple months, I just can't say enough about everybody that's out in that parking lot.
Yeah.
Wherever that parking lot is today, tomorrow, and the next week, these people are dedicated. Last week, we froze our rears off out there in the snow and the thing. Today, it was pretty warm, but these people are just, they keep coming and coming, especially our volunteers. We've got some little flux going on with personnel through FEMA and everything else, but we're working that. But I just can't thank those people enough. It's truly an honor to go out there and work with them day after day, and we laugh and smile and have a good time most of the time. Right, Lisa? Okay, most, okay. Thank you.
Thank you. Great words.
I do have one quick.
Yeah.
please.
Councilman.
I just wanted, one of the questions that did come up, and it's a question in my mind, it'd be nice to visit, what is our role in our region when it comes to all the works happening with our homeless population? And just as a health board, what is it, what's our parameters? I know in the past we've talked about it, we obviously have seen some new things happen in our region recently. It'd be just good to visit. Thanks.
I'm sure our district health officer can work with you on which departments work the most closest with the homeless and set something up. Any further comments? Seeing none, we'll close the board comments, item 14, move on to item 15. Susie, any public comments come in?
No registered public comment.
None, we'll close public comment, we'll move to adjournment.
So moved.
Moved in a second, all in favor?
Aye.
All right, thank you guys, be safe out there, appreciate it.